Yes, ma'am.
It's true that it's at their discretion sometimes not to disclose the risk, so they feel it's not, it's reasonably will affect you in a wrong way.
Yes.
So maybe I'm not articulating exactly, but that's the problem, and that's really screwed up.
Yes, she raises the point and says, listen, it's within the doctor's discretion whether or not to tell the patient about all the risks. And you are right in the sense that they have to exercise their judgment, their best medical judgment, to determine what risks you need to know about. And that becomes a fight. But I address this because now you're deciding whether or not they may have a valid case. And now all you hear from them is just, the doctor didn't tell me, the doctor didn't tell me. But if you don't have a medical expert who confirms that there is also wrongdoing that occurred as a result of this and they suffered a physical injury, you're not going anywhere. Now, let me also tell you this. In a malpractice case, when you bring a claim for lack of informed consent, we are required to bring in a medical expert to support that particular claim. Now, imagine this scenario. The doctor's on the witness stand, our expert. Dr. Gold, I want you to assume that Mrs. Jones has testified that the doctor never told her husband about the following risks, and she was in the office at the time. Based upon that fact that he didn't tell her about the risks, benefits, or alternatives, would you agree that's a departure from good and accepted care? Yes, I would. Wonderful. And would you agree that they no longer had the ability to make an educated decision about whether this procedure was right for them? Yes, I would. Thank you, doctor. Now the defense attorney gets up. Dr. Gold, I'd like to ask you this question. I want you to assume that Dr. Gonzalez has testified in this trial that he did tell the patient about all the risks, benefits, and alternatives. Assuming that to be true, would you agree that the doctor did everything appropriate in educating the patient about their options and benefits and risks? Yes, I would. Thank you, Dr. Gold. Have a nice day. So now what are we left with? We're left with a jury who still has to make a decision about who they believe. Do they believe the patient? Do they believe the doctor? And it's never a good position to have only that claim and to rest only on that. Which now brings me to psychological injuries. If you learn from talking to your client that this person went to a doctor, they were verbally abused, they suffered all sorts of emotional, mental trauma, but have no physical injuries, I am going to make another strong suggestion to you. Run, run, run as fast as you can away from that possible case, in a polite way. And the reason I say that is because those types of cases come with a tremendous amount of baggage. Those patients typically have histories of psychiatric and psychological and emotional problems. And now, as an attorney who's trying to identify whether or not the injuries occurred from the doctor's wrongdoing, it's going to be extremely difficult, if not challenging, to show that they are separate and distinct from the problems the patient had in the past. And again, this is not to say that they don't have a valid basis for a case, they may, but if all they have are psychological and emotional injuries, my recommendation after doing this now for more than 24 and a half years is to stay far away from it. And there are some attorneys, some really smart attorneys who will take on those cases, and I'll just tell you quickly about what types of those cases are, where you have a patient who's in a psych facility who is suicidal. And now they release the patient, they think the patient is fine, patient goes home and 2 days later kills himself. There may have been warning signs, indications that the doctors at the hospital misrecognized, and now as a result, the patient kills himself, and that type of case may be viable. But for the most part, the psychiatric injury cases, stay away from. Focus on the ones with injuries together with the psychiatric and emotional injuries as well. Always look to see what physical injuries have occurred.